Good afternoon. Welcome to the meeting of the Massachusetts Board of Early Education and Care. I'm Noni Lasso, Chair. Pleasure to see you. Sorry, someone just muted me. I'm unmuted now. All right, well, it's great to see you all. We are obviously have a data-driven set of agenda items, which is fantastic, that span sort of some extensions to our conversation in January around COVID supports and operational supports, through to picking up on the strategic plan and thinking about the family access piece and the system that we have. Appreciate the level of detail in the slides, as well as reminding us of some of those child-focused initiatives that we have running across different aspects of the system. So I have a number of notes. I think that I will make some more remarks when we open to the item that's around the strategic plan, and in particular thinking about the design of the system for more access. But there's certainly a lot to consider short-term and long-term, and appreciate the commitment to data. So I will turn it now to the Secretary.
Thank you, Madam Chair. Hi, everybody. I don't know if you're hearing an echo. I'm in a room that is extremely echoey as far as I'm concerned. So it's ringing in my ears. I don't know if it is in yours. I think what I'll do is just provide a very brief update on the governor's FY23 House 2 budget submission. As you know, this process is one that drags out. I shouldn't say drags out, extends for 6 months or longer, depending on the year. And it begins with the governor's budget, and then there are obviously hearings, and there's House budget through Ways and Means, and then followed by a Senate budget. And so this is the beginning of a long and ongoing and often complicated process. But obviously an important starting point as well. And the governor's FY23 budget allocates over $800 million to early education in order to sustain funding for the combined caseload accounts, including an expansion for DTA and DCF programs, primarily aimed at improving participation in SNAP employment and training programs, while providing additional emergency childcare services for DCF children. House 2 also supports an increase of over $50 million to implement the new, more equitable parent copay schedule, which you're all quite familiar with, whereby 98% of the families will be paying less than 7% of their income on a per child basis. So obviously a big initiative on the part of this board and this department, and that's incorporated within the governor's budget. Looking back to the beginning of the Baker-Polito administration, up until and through the FY23 submission, we've increased EEC spending by over 50%, not counting the hundreds of millions of dollars in COVID-related expenditures that have begun to flow during the last year to stabilize the field and restore capacity. Of that $275 million increase, we've prioritized increasing provider rates by over now $150 million cumulatively in order to improve staff compensation and quality. Beyond House 2, the governor will be proposing additional early ed investments as part of his upcoming supplemental budget filing, using both federal and state resources to extend the stabilization and operational grant program. And you'll be hearing more about this shortly, hopefully in the coming days and certainly weeks. So with that quick summary, happy to turn it back over to you, Madam Chair.
Thank you, Secretary. That is a look back. I haven't really seen, I'm not sure that we've done that kind of look back in a while on those numbers. So that's great to hear about. Okay, I'll turn it now to the Commissioner.
Thank you so much, Madam Chair. And building on the Secretary's comments around the budget, I think one of the things that I'm hopeful as we head into today's meeting is to, and I will go deeper as we look into each agenda item, but just to broadly hit upon some of the things I'm really excited about having this data today and being able to start the discussion. Is the fact that we have long talked about the the learnings we need to do from the last couple years of COVID, and how we will apply those learnings to rebuilding a improved system moving forward. And we find ourselves today at right now at EEC at the intersection of having some analysis that allows us to really understand what should we have learned, what should we be learning actively now, and at the impetus of looking ahead at rebuilding a system that is outdated, and we have long known from the origins of the strategic plan needed to be addressed, and really using the data to drive how and where and in what ways we should be addressing this system. So we'll talk a little bit about it as a little bit more deeply as we look into each section. But I really am excited today, as Chair Lasso hinted at in her opening comments, of really looking at the launch of a ongoing conversation with the board and the field around how we apply what we've learned over the last couple of years towards literally putting in operationalizing, practicing what we preach in terms of applying the data to future planning. Again, looking forward to it, and I think as the Secretary said, as we strategize with the administration on the proposals ahead, making sure that we are in dialogue about what the best route forward would be for the field. I also want to acknowledge, we'll talk a little bit today around some updates based on our last meeting of where the field is in terms of COVID, the COVID numbers and the COVID inputs. And I think we are at a point now to really be thoughtful about the process forward. And as we look to align with our elementary and secondary education colleagues around changes that they may be considering, we certainly want to make sure we also are deploying and being thoughtful about the reconfiguration of our own system to be able to be as responsive and thoughtful to both the programs and the families that we are responsible for. And so with that, I will just eagerly anticipate the conversation and the dialogue today.
Great, thank you, Commissioner. We have one item of routine business, which is to vote on the minutes from the January 11th meeting, our January 11th meeting. So I will make a motion that, oh, sorry, let me ask anyone, any edits, corrections, anything? Okay, let me make the motion that we approve the minutes from the January 11th, 2022 meeting of the Massachusetts Board of Early Education and Care. Can I have a second?
Second.
Thank you, Paul. I'm just going to go on my screen. Joni Block.
Yes.
Sheila Balboni.
Yes.
Paul Belcito.
Yes.
Nikki Ruiz.
I wasn't present.
Oh, I'm sorry, you weren't present. Apologies. Dave Cruz.
Yes.
Maura Siegel.
Yes.
Jamela Lee.
Yes.
Secretary Pizer.
Yes.
Allison Schoenwald.
Yes.
Thank you. Approved. Okay, we will move now to our first update, which is a COVID update, and I will ask Caitlin Molina to join us.
Excellent. And I just wanted to give a quick introduction to that, Chair, so if you don't mind. As we look through the entire agenda, one of the things we wanted to focus on is be able to have Caitlin give us an update on where we are on some of our COVID operational supports, the impact that they're having, and our close watch of the numbers as we've been responsive to the field. I do want to highlight, as I introduce Caitlin, is that this is part of our sustained infrastructure to ensure that we are continuing to maintain safe operations and have resources available to programs, but also return to our more normalized operations in terms of program oversight, support, monitoring. And with that, we are, Caitlin will talk a little bit more about some of the details of why the numbers are indicating this, and the preparation that we'll be communicating more about over the next month. But we will be going back, as the federal government has asked us to do, to unannounced visits over the course of the next couple of months, with the idea that we will be back by our federal visit in April to compliance to the unannounced visits. For those of you who may not follow our visiting schedule for programs on a day-to-day basis, during COVID, we did first suspend all in-person visits for the initial months of COVID. As we went back and programs reopened, we did go back to in-person visits, but made them announced so that the licensor and our program could have conversations about what kind of safety protocols. And again, as Caitlin talks about the numbers, we feel we are ready to go back into that federal compliance of having unannounced visits. Of course, this will be a conversation with our licensors and the field, so it's not a tomorrow question, but we did want to highlight these numbers in relation to some of that return. And we'll be working deeply with the field over the next month to make sure that everyone understands what that will look like and what that will mean for their program. And with that, Caitlin, if you want to review some of what we know.
Commissioner, you want to just make an announcement for those who are viewing about the potential IT issues?
Thank you very much. I forgot that twice now. We are having some internet issues at the Boston office, and so we do believe we have them fixed and should be on track with the Zoom platform that we're using. But should we have any issues, we will be taking a break and employing our backup plan for internet. And so just appreciate everyone's patience if we do get interrupted and need to break momentarily. So thank you very much. And now I'll hand over to Caitlin.
Thanks, Caitlin. Great to see you again.
Thanks, Commissioner. Just also confirm, am I the backup plan if the internet goes out? No? Okay. Good morning or good afternoon, everyone. It's a pleasure to be with you today. I first wanted to support the Commissioner's remarks with our return to unannounced monitoring visits starting April 1st. This is something that we've collected feedback from both our field, our providers, our community advocates, and licensors directly that there is an emerging need for us to get back out there with an unannounced model to support programs. We have done a phenomenal job of working creatively to identify the needs of programs throughout this pandemic and utilizing a model of scheduled visits to provide more proactive support and anticipating what would be coming with a licensing visit. Now that we are seeing decreasing case counts, we have the Commonwealth's executive order requiring proof of vaccination for all employees, and we've been distributing PPE for months now. We feel like there is a unique opportunity to gradually revisit our return to unannounced monitoring. And so we've started working with guidance with our licensors about what that will look like. For our programs, that will consist of a variety of strategies over the course of the next 60 days to begin orienting back to this operating model. We recognize that we're all out of practice with doing unannounced monitoring, and so it's going to take us a little bit of time to get back into that swing. Licensors have already, for some of you, been able to provide a range or a date range and when you can expect a visit as opposed to a specified date and time. That is one example or one strategy of how we are moving towards this unannounced monitoring method. We will continue to partner with programs and work responsibly to support them in understanding how we are achieving health and safety compliance when we schedule our visits. And then as we move to unannounced, how we will maintain that health and safety compliance in a way that feels both supportive, but also in alignment with our federal mandate to conduct these unannounced visits. So more to come. We have begun socializing and working directly with our licensing teams about what this will look like for them over the course of the next couple of weeks. And then we will build out more comprehensive messaging for the field over the course of the next couple of weeks as well. Just want to reiterate that this will be a gradual return. And so we really are eager to partner with you all to make sure that you feel comfortable with this model. And certainly licensors are excited to be able to have that flexibility to more uniquely meet the needs of your programs on an unannounced basis. So board, with regards to COVID response, I think it is remarkable under the commissioner's leadership what we've been able to accomplish under just 30 days. We have become the first state in the nation to launch a testing program for childcare programs across the state. We have almost 3,000 programs that are actively enrolled in a rapid antigen testing protocol. I am getting calls and emails every day from states wanting to know what we did and how we did it and how we're able to so rapidly support children and families who are accessing childcare across the Commonwealth. We have been able to strengthen and bolster a number of different COVID response strategies to support mitigation of the virus across our programs and across our communities. As you'll note in your board materials, we are seeing a slow decrease in the number of COVID incidents that are being logged in our lead portal as a result of sort of the more broad case counts decreasing over time. We were able to make some modifications to the reporting requirements of our programs. We heard that there were rather burdensome reporting requirements being expected of them. So we were able to partner with our colleagues at the Department of Public Health to streamline those requirements, to be more concrete about when programs are reporting COVID incidents that occur in their program, to make those specific to COVID incidents that are impacting their operations. So that is significantly limiting or decreasing the number of cases that we're seeing logged in lead. And so I want to highlight for you that with the significant decrease in cases that are being logged in lead, there are two sort of lagging factors to that. One is the overall case count decreasing, and second is the department's commitment to reducing the burdensome reporting requirements that were being asked of programs, and that has inevitably reduced the overall number that have been logged. We quickly adjusted our mobile PCR testing sites. As a reminder, we have 8 mobile PCR testing sites that we have created across the state to support access for testing for children, educators, and program staff affiliated with an EEC program. As a result to the surge in January, the Omicron surge, we immediately modified the operating schedule of those PCR testing sites and increased lanes of traffic to provide more immediate access to families and staff who were in need of COVID testing. We are working on a contract modification with this vendor, Visit Healthcare, to provide us with a little bit more flexibility in the future to ramp up and ramp down in response to emerging needs with the virus. We feel like the PCR testing sites are a supportive resource for both our programs and our families, and we are very much committed to maintaining that resource over the course of the next few months. As I mentioned, we stood up a rapid antigen testing protocol and program for our programs across the Commonwealth. This added additional layers of testing as a strategy for programs, many of whom were already participating with neighborhood villages and our pool testing program. We are now distributing rapid antigen tests to programs for 2 purposes. As a reminder, one is for symptomatic rapid antigen testing. So for programs who are serving children and staff, individuals who become symptomatic while present at the facility can have access now to a rapid antigen test. This protocol allows programs to more rapidly identify positive or symptomatic individuals within their program who may need to isolate to prevent further transmission of the virus. Additionally, we're offering rapid cohort asymptomatic testing, which is very similar to the DESE Test and Stay program, but is uniquely contextualized for the purposes of childcare settings. It allows asymptomatic close contacts of children who test positive to remain in childcare as long as they continue to test negative daily for 5 consecutive days using a rapid antigen test. We've partnered with neighborhood villages, and since the inception of this program, we've distributed more than 500,000 tests in less than 30 days across more than 3,000 programs. We are seeing high utilization of these tests across the programs and are working to build an online portal with Salesforce in neighborhood villages that will go live on February 14th, that will allow us the opportunity to more regularly provide you with aggregate data and results of the testing protocols that are being administered. In addition to the portal going live, Neighborhood Villages has been working very closely with the department to offer training, resources, consultation, and technical assistance on the use of the tests. I get asked almost every single day, why Neighborhood Villages? Why are they the partner that is able to support the department with executing across this strategy? I have never seen an organization work so hard and so committed to supporting an emerging need across the workforce. Neighborhood Villages is an incredibly strong group of women who have prioritized testing access for childcare programs. They understand the unique environment and context of childcare. They are uniquely equipped to support professional development and training needs to administer testing, and have also supported us with identifying a resource and a contract to stand up an epi line. So we are working to launch a fully operational epi line by February 11th. We've piloted this epi line with programs who are currently participating in our rapid antigen testing program. So we are building frequently asked questions, documents, resources, and tools as a result of the inquiries that we are receiving through this epi line. Once we continue to pressure test this across our programs that are participating in testing, we will more broadly scale, as I mentioned, by February 11th to all licensed programs across the Commonwealth. They will have access to an epi line administered by Primary Health under contract with Neighborhood Villages to provide programs, educators, and families with a variety of supports in relation to COVID-19 and preventing forward transmission. So I welcome any questions, but I just wanted to thank you all for the opportunity to talk about the department's work to stand up the testing program and the incredible leadership of Neighborhood Villages, who was able to support not just distribution of tests, but implementation support such as training, resources, and tool development.
I would just like to thank Caitlin for her leadership on this, because this has been a rapid iteration from concept to delivery and responsive to the field, and partnering with Neighborhood Villages to not only identify, but also develop the real nitty-gritty operational systems that get tests from a warehouse, from the governor, the Baker-Polito administration secured tests across systems, and to get them from the warehouse to programs' hands and in use for children and staff and directors and family childcare has been remarkable. And really the development of an epi line is, again, the first in the country, leveraging national resources to develop something that will be available broadly to answer all those nuanced questions we know everyone's getting every day, and will continue to become more nuanced as we look at the year ahead. So thank you so much to Caitlin on that, and she deserves a lot of the credit.
Thank you,
Joni. Go ahead, Joni.
Thanks, Caitlin. Lots of stuff happening. I'm wondering if we can identify the structures that are in place that enabled the department to move so swiftly and so successfully to be the first in the nation to get all these out, other than the expertise, competence, dedication, and all of the staff, which I fully understand and appreciate. But I'm wondering, what's the special sauce that we did that is in the department? And is it possible that we can use those structures for other initiatives in the future? Because it was so quick and so wonderful.
I think that's a good question. And Caitlin, I'll jump in with a thought, and then very happy to have you contribute. I mean, I think that, Joni, as you know, the fact that we have a department that oversees so much of the childcare infrastructure is very unique. And so that is part of the special sauce, is having an EEC that oversees licensing for childcare, investigations, monitoring, distribution, workforce, for a sector that largely across many other states has those components sitting across so many different departments, which makes it very difficult. So someone like Caitlin doesn't exist in many other states that has oversight over so many different components and can speak on behalf of the field with a unified voice in that way. And I think that for us right now, and I is partially, and we'll reference this a little bit as we look at the future and the structure, is the investment we've made in some of the operational management capacity. Expecting a license, I mean, if anyone remembers from the beginning of COVID, some of our PPE distribution early on was because we didn't have this capacity. Some of our gaps in that was that we didn't have this capacity and the management structure around it. So our licensors were literally handing out PPE. And at the moment, it kind of worked because weren't monitoring as heavily. We didn't have those responsibilities, but as we go back to some of the normal operation, if we go back to normal operations and we integrate some of them over time, having this management structure is allowing that to come off of those who have day-to-day responsibilities and be able to provide the intentional capacity that allows us to really iterate on an innovation and not take away from those really critical functions that EEC plays on behalf of the Commonwealth with our key staff who's there. So those are the two things I think that what we're learning. And also, as Caitlin said, I think, again, just a shout out to Neighborhood Villages, who really was thinking about what role does a school district play for schools, and how do we think about some of that on this other building some of that structure, because that, I think, as we have a unified department, we also still do have some of these gaps in local infrastructure that can go from a family childcare calling me or Caitlin to calling someone who can be more readily responsive with a specific resource. For the DESE side, school districts are playing an incredible role in test distribution, monitoring, support, guidance, all of those things that our programs don't have an equivalent, and we are building rapidly that equivalent. And I think filling in some of those gaps between state oversight and local programs that we have a unique opportunity in Massachusetts to do. Caitlin, I don't know, Caitlin also has experience in other states, so may have something to add to that too.
Yeah, I mean, I think, so there are two pieces. I think the resiliency of our field more broadly, like for this to be a direct request that came from childcare programs, made it so much easier to build a model that could support their use in administration. So for me, recognizing the resiliency and the solvency of childcare programs across the Commonwealth, who were emailing us every single day saying, I will figure this out. Kids are missing out on care and education, and families are not able to go to work. I do not have the tools or the resources at my fingertips to prevent that. Given the tools, I am confident I could support it. And so it was really the department and the administration setting up a framework for childcare programs to execute and for us to build the resources and the tools that they needed to feel confident in doing that. I've also worked in state government for a long enough time to know that, like, not every administration is willing to act so boldly as to just procure 26 million rapid antigen tests and then communicate an expectation that they be distributed within 30 days. That is a bold and very committed strategic vision of this administration to support access to childcare. And it was one that I remember texting Catherine Premont, our chief of staff, and the commissioner the night we found out about it, being like, are you guys ready to build the first testing program for childcare across the nation? Because it was so easy to have a moment of fear around what we were going to do with this many tests. But we did have a program and we did have a field that was so willing to step up to support implementation. And we had a unique partner in Neighborhood Villages that understood the complexity of the childcare sector with our partnership to be able to administer it so rapidly, but so effectively. And I think the engagement opportunities that this department has provided for the field to either directly or indirectly provide us that guidance or that feedback around what's working and what's not working has been really helpful. And I'm really proud of the field. When we were doing the trainings directly around the administration of the testing, I remember reflecting that it was just almost 2 years ago that people were asking questions around how to safely use Play-Doh in programs during the midst of a pandemic. And now they are administering rapid antigen test. And it speaks to the incredible strength of our educators, not just as educational leaders, but as operational leaders to be able to take on that task. It was phenomenal.
Thank you both. Thank you.
Any other comments or questions before we move on? Okay, thank you, Caitlin. So I think we'll next hear from Jocelyn Bond on the C3 operational grants.
Thanks, Madam Chair. Happy to provide an update on where things stand with the operational grants and also some follow-up analysis work that we've been doing to understand the ways in which the supports we are providing for programs have shaped the level of closures and the stability that we are currently seeing in the field. So first of all, you have some information in the slides that were shared with you about the take up of grants. We continue to see program take up growing over time. We now have 84% of the programs participating in the grant. And also, just as a reminder, we have expanded access to the grant in January. Programs that hadn't been eligible because they were licensed or funded after March 11th have become eligible and can come in, were able to come in January and start applying for funding, going back to the point in time in which they were either licensed and funded. So, if they were licensed in September, they could begin applying for the grant in September. So this also reflects a significant increase in the numbers of programs receiving the grant as well. We also have been looking and tracking to the best we can the enrollment that programs are reporting. And we do see that enrollment continues to increase, although I think, over time, with particularly seeing the greatest increases in center-based programs. And we do see some variability across region in enrollment percentages. I will say, having looked at that, having dug even more deeply into that with some support from the team at 3SI, we see that type of variation is across all different geographies. So you see variation at the town level as well as the region level. And we've also shared the ways in which programs' percentage capacity is enrolled across the different age groups. This also varies in similar ways across region, but we do note that FCC programs are more likely to fill more of their capacity with infants and toddlers, while the school age enrollment is greater in center-based programs, which I don't think is surprising, but it is helpful to see that in the numbers. But then when we look at some of the, sort of one of the goals of this grant is that we've been trying to stabilize the field, and we're now moving into 7 months of grant funding, and want to take a backward look at what has happened over the last year and a half with program stability, in particular to understand the closures that we've been seeing in programs. So, we have a number of slides here where we dig a little bit more deeply into some of the patterns that we're seeing in program closure, but we do note that between March of 2020, when the pandemic began, and December of 2021, we've seen 17% of programs close. And then when we look more closely at the characteristics of the programs that we're closing, we do see that there are definitely trends in the types of programs that have been closing. And if you want to follow along, you can start by looking at slide 8. And the first figure in slide 8 shows the differences in the closure rates for programs of different sizes, with the greatest and steepest line of closures happening for FCC providers and programs with less than 40 slots, licensed slots within the program. And larger programs are far less likely to have closed over that time period. When we look at the way subsidy funding has played into this and where programs are located, there is also a figure there on the bottom left that shows the numbers of programs closing across different levels of subsidy uptake. So each collection of bars reflects a different type of subsidy uptake, with the bottom bars showing programs that do not take any subsidies, and then increasing programs that enroll about 1/3 of their capacity with subsidy, 2/3, and then almost between 2/3 and their full capacity. And overall, what we do see is that subsidy uptake does seem to be protective for programs across different types of communities. So it's important to recognize that those dark blue bars reflect programs in the highest SBI communities. Those programs are not necessarily closing at higher rates. We do have a lot of programs in those communities, but the difference between programs in those communities that accept subsidies and that don't is really, I think, particularly stark. And that pattern is true across all the different geographies the programs are located in. So we also wanted to look at these distinctions by the nature of the funding that programs were receiving and dig a little bit more deeply into that, as well as adding in the stabilization funding and understanding whether that showed any differences and trends once that came onto the scene. So on slide 9, we do look more closely at that. And here you see a figure where the light blue bar reflects programs that are not receiving subsidies. So the subsidy system was used very intentionally as a financial stabilization force for programs that were receiving subsidies, particularly early in the pandemic. So those programs received that type of early assistance. And then at the point where you see the dashed lines branching out, programs started to receive grants as well. And you can see 2 things happening in this figure. First of all, programs that receive subsidy were less likely to close. But also that when the stabilization came on board, we only saw 7 of the programs that received stabilization grants close. And you can see that it does look like across the board and in both of these groups, when programs started receiving the grant funding, for those programs, the closure rates did seem to stabilize. So, there is a signal here that the funding that the state has been putting out to support programs really has played an important role in stabilizing the field as intended. Are there any questions on anything? I jumped through a lot very quickly.
I just want to highlight.
Oh, sorry.
Can I just highlight 2 points? And I think then I would like to have Jocelyn highlight one more thing before we open up to the board for questions that doesn't exist in some of the data, putting together some of the things you have seen in the past versus some of what we have here. First, I think just noting one really important thing that Jocelyn said is that it is not necessarily that programs in higher social vulnerability index are closing at higher rates than programs elsewhere. We do actually have more programs in communities that are higher SVI levels than those that don't. So I just want to note that as you look at this data, that that is a pre-COVID and during COVID trend, that our density of programs in higher SVI communities is higher. The second thing I just want to highlight, and Jocelyn, connecting some of the data you've had before, is the fact that there is one of the things we see is that our programs with higher subsidies rates do tend to have different compensations than those that are largely private fees. So just to kind of understand that there is a linkage of the operational costs, which is the staffing, and the revenue that programs have coming in, which is probably influencing some of these dynamics.
Mm-hmm.
Maura, go ahead.
This is great. Both the data itself and then the correlation to how important subsidies have been. So what do we know about those 491 programs that closed, or just in general, why programs are not accessing the subsidies?
Do you want me to jump in on this one?
Well, I will start with, I should have said that up front, is that this tells us what we do know. There is a lot we still don't know more. And so I think the short answer is that we don't know. We got this data, we've been looking at it, but that is a qualitative question that we haven't yet had the capacity to dig into. We've started working, thanks to Paula and some of the philanthropic people who are interested, is to understand what kind of data might inform a more qualitative look into those questions, why people didn't, calling and asking why they didn't access the grants. There's a number of different reasons that might have influenced this. We've heard anecdotally just distrust of public funding as a baseline of just I'm not sure I want to accept public funding. And you certainly see that in something we've been talking about through the board meetings of programs who accept subsidies were the first ones to access the operational grants at higher levels. And so there is some indication that maybe there is just some distrust. But more importantly, I think that there is a lot of questions of what kinds of, as the secretary said up front, as we look towards funding and understanding the sustaining of grants, what kinds of signals do we need to give to make sure people feel that these are accessible for them? Is it about make an ease of access? We know that it's pretty quick to access these grants, and so is there something we should be doing to make it even easier? Is it about duration of funding? Was it not early enough? How do we start to really respond in a way that will help us with that qualitative lens that we don't have yet, and know that there's a much deeper dive? So the short answer is we don't know. There's a lot of hypotheses that we need to dig into, and Jocelyn, feel free to dig in deeper than that.
No, I mean, I think beyond what you've already said, which we know that programs that receive subsidies are much more likely to be coming in for the grant. And we have looked at that, and we didn't reshare that analysis this month, but the trends continue to be pretty stable. I would just say, I think that there's also a lot of individual decisions that are playing into this that are driven by many different things, which is why the qualitative piece would be so interesting. I've gotten questions through the grant line saying, well, my enrollment is low. Can I apply for the grant? Just a lot of programs feeling like maybe they're not eligible, maybe they shouldn't apply for a whole host of reasons that are individual to their program. And certainly, I think the programs that are in our subsidy system are more tightly connected to our lines of communication. But we can continue to put the word out. And I think the growth over time is also reflective of the fact that the word has started to spread in the field that this grant is accessible, and it's relative, aside from the time that goes into applying, it is relatively non-restrictive.
Paul,
Oh,
Paul, and then Sheila.
Mm-hmm.
So Commissioner, just and Jocelyn, just thank you. I think this data is really important for us to understand across the Commonwealth on ways that we can increase that access. And so, you know, I appreciate the leadership that you all have shown across the country, quite frankly, on some of the programs we've done, and to just, I think we all should feel some responsibility to continue that leadership, to kind of continue to find that 16% of providers that are not engaging in these programs, and just continue to double down and figure out how we can help stabilize them as you've outlined. And so just, I appreciate it. I know we've had some conversations. This is kind of live too. I know you guys are working hard on this, and appreciate kind of the insight that you provided today.
Sheila.
Just a quick question on the question of why some programs did not apply for the funding. I'm wondering, Jocelyn, did subsidized programs receive more money? Was there a cost benefit consideration here? I put all the time into going for this, but it's not enough money maybe to make it worth my while. Could that be that play at all?
It's possible. I mean, certainly if you have more than a third of your enrollment or your license capacity serving subsidized children, you would get more money. You might, if you're depending on where you're located. And yes, we have seen differences in terms of engagement around those types of factors that should shape the size of the grant. It might be a piece of why some smaller programs aren't coming in as well.
Thank you.
I think what I would say, Jocelyn, I'd put even a finer point on that around it, and to your response. I think the previous board decks we have looked at the sort of average per child amount, or sorry, per slot amount, and base level amount that we had been looking at, and it continues to be the case that programs who receive any subsidies are getting higher levels of operational grants too, due to the way the formula works. Those with infants and toddlers, serving infants and toddlers, do have higher rates given the way the formula works. So those things we hope balance out some of the is it worth the time. I would not discount the fact that for smaller programs, the administrative capacity to do anything right now is limited. If you are a program without an extra lead teacher or without an HR person, which is many of our programs that have, average, this is pre-COVID, we haven't run all of the data because of the moving target, but pre-COVID, the average center-based site was 5 classrooms. If you are on the lower side of that average, you may be filling in for teachers right now and not have the capacity to do that. If you are on the higher side of that average, you likely have an additional HR person or administrative capacity. And many of our larger subsidized programs will say we're in a better position administratively. But I think what we're seeing is those small programs just may not have the capacity to do much right now. And I don't think that should be discounted.
Thank you.
Paul, did you?
All right.
Oh, you're good.
I think this is really important. And just on that, to amplify that, I think that's where some conversation needs to go about the collective commitment in the community to this as well, right? How do we find trusted voices? How do we build capacity for the providers that don't have it, to your point, Commissioner, because that is real. I just think the data point that sticks out with me, that since this is launched, 453 programs that closed, only 7 were participating in the grants. Like, that's telling us something. Not sure exactly what that whole picture is, but it's certainly telling something. And, as we look at, again, the 16% of providers across the Commonwealth that are not participating in it, just really making sure that we're adding capacity and finding creative ways to do that if we have to, for them to get these access to these programs. Thank you.
Absolutely. And I think this is one of the things, like building on the board's ongoing conversation about public-private partnership, building on the ongoing conversation we've had of where and how we drill down in data and the nuances and the individualization of the field. There's probably not a monolithic answer to that 16%. And one of the things we really need help with is to be able to say what information would trusted entities on the ground be helped with, and how can we dig into some of that? Because it's not always going to be EEC that is best primed to do the outreach, to do the connection, to be able to build this. And so by starting this conversation and the data conversation I referenced with Paul too, of trying to understand what kinds of ways can we disaggregate some of this with our partners that would help EEC play the best, most efficient role as a public government department, statewide department, but still empower those who might be working directly with programs. And I think harkening back to the conversation that Joan was asking around what kind of structures should we learn from, I think have some demonstration points of how you configure some organization around childcare from our COVID years. That will teach us, I think, how we can best leverage those resources on the ground to support a very different and nuanced system in communities.
Yeah, and it's important to keep in mind that we're probably in third variable territory, right? Which is like, what does the grant participation represent or not represent, and what's underneath that? And certainly it isn't likely a monolithic group. Can I just say one thing, Maura, before I turn to you? I have been thinking about, when I did a deep dive on these data, I started to think, and I wanted to raise it now, in light of the first two items, there's a really significant gap between participating in the COVID testing and uptake on the testing front and the operational grants. And of course, time matters here, which is the operational grants have been available for much longer, but I'm not sure we're tracking. I think if you adjusted for time, we may have far less participation in the COVID testing. And I'm really interested in that, in how you guys are thinking about that, because that's just a place where your raw numbers, if you put those in percentages, they're kind of like bottom quartile, right, of all programs. And yet this is an unvaccinated population, and we think a lot about the educators and their safety as well. And so I was just curious for thoughts on that potential discrepancy, I think, even if you adjusted for time.
Yeah, I think we are a little bit early on the testing part, one, because we have been watching week over week numbers, and we've just started to taper down enough to say, okay, we might be stabilizing. And now to understand that discrepancy, we were still seeing 500 or so programs a week sign up, which was equivalent to what we were seeing at the early days of the operational grants too. But I think this is some of the question that we've been trying to work out with partners too, is to start to look at, where is the overlap of who is engaging in multiple different operational support strategies, and again, to the point of trying to find that third variable, trying to kind of get some trends or understanding, and then hopefully leverage some private partnerships to do some of that qualitative conversations, to be able to build a little bit more nuance to what our raw numbers might be able to tell us. Because I think the answer to that is probably more nuanced than we'll be able to see in just data. We'll look at location and program type and all of that, but there will likely need to be conversations to understand it better, focus groups, something like that.
Maura.
So now that we have this amazing data set and we see this correlation, I'm just wondering if you guys want to put a stake in the ground for a month from now when we meet. You want 84% to be what percent? And in 2 months, you want it to be what percent? Like, set a goal. And you know what? If you don't hit it, it's going to be okay, because you're going to explain why. But like, set an ambitious goal and do the root cause, do the hypothesis testing, but do it in service of knowing you're obsessing over this, because it's so clear that it's a driver of, or at least we think it's a driver of preventing closures, which couldn't be more urgent right now.
Yeah, and I think this will also get to what the secretary was saying. I think one of the things we believe is a dynamic in here is, and again, this is a hypothesis, because without having the qualitative data of what's happening with those programs that did still close after the operational grants were available, it's not clear like what exactly is the point. But I think we did see programs continue to close after the operational grants weren't there, which might have been an indication of the level of the grant. It might have been an indication about the long-term commitment of the grant. It might have been the understanding of the operational deficit, their own budgeting of the operational deficit they were in and need to come out of. So I agree. I think we have to set some of that. I think that the budget conversations will help us be more appropriately set the targets. So I would like to see us continue to increase slightly, but I think really strategize and not just say net, what is our total, but start to break down that 16% of those programs most likely to close and start to target those. Because there are programs that may not in that 16% that may be saying it's not worth it to me. I have the revenue, I have what I need. And we don't want to bump up into that, pushing into a public system if it is, if they are sustainable. So I think that's some of the next work we have to do to be able to set appropriate targets, particularly as we look at an FY23 possibility of investment, of really understanding what that would be. Where our biggest concerns should be to focus on. Is it regional? Is it program type? Or is it a service to a certain population after the grants? And I think that's going to be, this is why, as I said to Chair Lasone before the meeting, I'm very excited that this is a launching of a long-term conversation today, because I think as we flip to the other, it's part of the agenda, and we look at the historical system that has sustained the infrastructure, there are some choices also to make on that of how you balance those program infrastructure investments and the family affordability investments, and making sure that your population targets across both are lined up and mutually reinforcing. And this will be a year-long process for us as we look to really rebuild and restructure the system.
Allison.
I have a slightly different question, and it's, you're acknowledging that there's an association, but clearly not necessarily causal, and understanding in a pandemic, lots of things have closed, lots of things have shifted, lots of things have changed across every industry. Anything that has to do with inequity, right, has been exacerbated. So I was wondering, I understand the idea of having goals, but I mean, what is our goal, right? Also, a lot of people have died, right? That's unfortunately, so there's such a shift. I guess what I'm wondering is if you have data from any other states about the numbers that have closed there, or the percentages or the distributions. We don't have a standard norm of how many daycares are expected to close in a pandemic, but we will now, right? And so sort of because of other systemic factors that maybe, part of that is part of understanding that would lead to a different direction of intervention.
Yeah. That's a really good question. And I think one of the things that I did just get a tag on just to clarify in some of that 16%, this data has not been fully lined up. So some of the 16% may be some of those programs who have closed. So we're still cleaning up that data. So again, to get the targets, we'll look into that. And I think, very much thinking about that. I think, Allison, to your point, I think one of the things we know from other states is the fact that we are, and I think it's complicated, that we are doing much better than many states in terms of reopening data. However, one of the national problems we have on this is that it's really hard to compare apples to apples, because a school definition of a childcare in Massachusetts is different than the definition of a childcare in North Carolina, who's also seeing great rates in terms of reopening. And that there's just a very different, for example, religious care has an exemption in North Carolina in a way that we don't offer the same sorts of exemptions in Massachusetts. So it's just a little bit hard to compare apples to apples. I think there's a couple things that we should start looking into on that. Is one, start to disaggregate the center-based closing and the family childcare, which you start to see we've started to do here, because our family childcare system is one of the most unique parts of the Massachusetts system. The way we've regulated it, the regulations they meet, and the licensing process is very unique in Massachusetts compared to many states that don't have that kind of structure and support around the family childcare systems. And I think that's where we've seen a lot of programs close. That is a trend we saw prior to COVID. Our strategic plan has been calling that out, looked at national trends. The country saw family childcare closing. But I think, Allison, to the other point you make is that when we start to try to understand, then now we have started to see programs reopening as well. And as we've started to see that, how do we kind of foster and fuel those places that will do, and I think this is bridges to our next conversations as well, is what structures and systems do we need to support that will have programs open up to meet the new reality of the Commonwealth, those places where populations have changed, other industries have closed or shifted that we need to be responsive to, and the dual nature specifically of the EEC sector of both being a family support and a child development support, and understanding those two things when child development has shifted because children are coming in with different experiences, but family needs have shifted profoundly with those changes you referenced, and being able to disaggregate our system and set targets that are really nuanced based on where we project the needs will be, which gets to some of the things we started to analyze in the second part of the conversation there.
Thank you. Any last questions on this agenda item? I actually also think, I have to say, just as a segue to our next conversation, I do think this sort of serving the same population but not participating in subsidy just leads you to ask questions about backing up and designing something that is about, that is a system that serves populations, right? And so I was struck by that a couple of times, just thinking about, the ways in which you might, what the blank canvas might do in terms of design principles in the first place. So we wouldn't actually see that kind of data point, which sort of says a lot about two similar children with potentially two wildly different experiences, et cetera. So on that, I think we are about to shift gears to the strategic plan. Why don't we take a 10-minute break and we will reconvene at 2:10. Thank you. Okay, excellent. Well, this section of the meeting is, in my view, actually very connected, very good segues in the first and second items to this larger. So where are we at in terms of the strategic plan that none of us will forget past the month before COVID hit. I think we will never forget that, and has been a great guidepost for organizing and thinking about some of the short run decisions, reactions to COVID, but also lots of what's happened over the last 18 months, to the commissioner's point, can inform lots of our strategic work as well. And I think many of us in many different ways have connected on this idea that the pandemic in many ways sort of amplified cracks in any given system or foundation, and or we had some great innovations and responses that have lessons learned. So here we are to kind of connect on the strategic plan in the domain of affordable access to care for families. And, you know, for those of you who have been on this journey for a while, the current regs are about a decade plus in vivo in living policy. And so much, even pre-pandemic, in the lives of working families and parents who are studying, lots about work and study has shifted dramatically, right? The ways in which we work, the ways in which we may access higher education opportunities to advance our education was shifting pre-pandemic and has only further shifted, right? So here we are with lessons about sort of these signals about infrastructure, but I'm not sure we know exactly always what we mean by the buzzy infrastructure idea writ large out there in the world today. But, I think especially for Paul and Maura and Jamila, I think one way that I really dug into these data was to remind and understood them, was to remind myself that when I launched into some of this work in partnership with EEC and EOE 6 or 7 years ago now, I was so struck and continue to be so struck by the fact that the system is in many ways organized around serving individual children as part of a family, right? That we're serving, and we've sort of often confounded the slot for the child with the systems building, right? That in many ways the two have worked in tandem and have been thought of as one and the same. And if you look at this COVID data and the sort of using the dollars for this notion of operations, it starts to drive you to think about the difference between a setting, an early education and care setting, and serving individual children. And today we looked at data that suggests, we can stabilize the operations and keep the doors open. Well, we have a decline in enrollment. So we're learning about how to stabilize and how we might operate more at some kind of unit level, right? At the level of the setting or the program, and start to think about maybe organizing a system administratively that is less about verifying individuals and trying to we look at that slide around the parent journey through to a slot. Like, you think to yourself, I don't know, 9,000 licenses, zip code determining a whole lot. How do we organize better? And maybe in all of this, think less about the infrastructure and the individual child as one and the same, and more about sort of places that serve children. So I'll turn it over to the commissioner, but it was sort of a walk back and a walk forward all at once today in looking carefully at this deck and thinking hard about what is the system one would design at this moment in time and looking ahead. And it certainly, for me, sort of gets me hyper-focused on the problems of the serving individuals through slots as a design principle, potentially. So I'll just put that out there. So Absolutely. I'll turn it over.
Thank you so much, Charlotte. So, and I think that this is what we are looking at the intersection of. So I wanted to just give a little bit of a historical context of where the strategic plan highlighted the need for development of, development of systems and investments in enhancement of systems. And then again, I think to your point, and hopefully what we've primed ourselves to think about today is to really start to understand how do our investments and our strategies that we've implemented over the last couple of years inform what we need to do going forward. There are two components I think that are really important to this, and we've broken this up into two sections of the agenda. And so just want to dig into that, because this particular goal of the strategic plan was intentionally designed as two complementary components of access. Of really thinking about how do we address the affordability for families, but also invest in communities to be able to meet families where they are, to be able to address the nuances, and not only that, bring all the players together to understand the needs of families in different domains. So we'll talk a little bit today about over the next couple agenda items to focus on the subsidy system, what we know, what we've learned, how that really does address family affordability to childcare. For those of you who watch the news, you know that cost of childcare, particularly in Massachusetts, has come up a number of times in the last couple of years, and really understanding how our affordability, again, to Chair Lasso's point, our strategies to address affordability have been intertwined traditionally with this infrastructure conversation. But if we want there to be a high quality infrastructure and it to be affordable, we need to start to detangle the data to understand how do we address that. That said, we know that for example, one example of this we'll dig into a little bit more is that school districts have, I think that, have a lot of money coming to them that are being invested in different ways. For example, many systems do, and to Allison's earlier point, systems have changed and shifted, sectors have shifted, and part of EEC's role is to make sure that we're investing in community capacity overall to be responsive to those shifts for families as well. And some of the strategies we've invested in over the last couple of years, we'll go a little bit deeper into what we know and don't and how we're thinking and strategizing on that as we look at the years ahead as well. But to start with, I wanted to contextualize, Eli is going to go a little bit deeper into what we know about some of the family dynamics in terms of what our subsidies are creating in terms of affordability, and where some of the changes in family demographics and regional distribution we anticipate as we look at this recovery period. I think as we've looked at that, one of the things I want to just highlight is the what we knew going into COVID about our subsidy system. There are multiple components of the subsidy system. We knew that there were regulations that had to be addressed in order to be able to change some of address some of the litigation we were engaged in order to be able to address some of the challenges we saw with the federal implementation of the federal subsidy system, the federal subsidy regulations. All of those components. We knew that regulations had to be addressed, and we also knew that we'd be needing to look at our contracted system as well. That in order to do that, we had contracts that were 12 years old, or now are 12 years old. They were 10 years old at the time, and that they were limiting for our programs to be able to address affordability overall, and that our system had different components that really, like childcare resource and referral systems, family childcare systems, those components that were designed to help address the access to these affordability strategies that really needed to be updated. We knew that before COVID. Now here we are 2 years later, and not only did we know that the system wasn't really there to address the overall capacity beforehand, but now we're looking at the data we have to understand what do we know and what don't we over the course of over the last couple of years to help inform how we strategize those changes going forward. Again, we know, and we'll talk about it after we look at the data, that many of the policies we were able to put in place due to COVID for our subsidy regulations are things that we may want to continue in our regulatory, as we address the revisions to our regulatory framework, and that will inform where and how we see different work strategies being addressed, where we see different different populations falling out in terms of who's entitled to childcare and how income eligibility plays out, that there are a lot of things we want to use this data to help set priorities, to Maura's point, to be able to track on a monthly basis what our goals are and how we can be targeting those. And so I just wanted to lay out that component, is that part of what EEC needs to do is spend the next however long it takes, likely at least the next year, to really start to dig into the solutions around these areas. And I think being able to address and look at what we know to this point is vital to be able to do that. And connecting to the previous conversation we had, that given that we've seen some different kinds of investments complement these types of subsidy strategies, it's really important for us to understand the intersection of these and where they need to shift in conjunction with each other as opposed to independently. And Charlie, so to your earlier point, to be able to both invest in the kind of infrastructure families need and the affordability strategies they have to be able to access that critical infrastructure, which still operates as a private market. And that said, and then we'll get to the second part and I will dig deeper into this and how that needs to fit into a broader community context that is actually what families are experiencing on the ground. They are not going to childcare, and that does not solve all of your needs, even if it is affordable. You still have a robust set of resources that have to exist in collaboration with each other at the local level. And so that will be the second part of our conversation, to understand, as we take these considerations, how do we use EEC's role to leverage and incentivize the kind of community level investments that might make that even more meaningful than just the child care sector itself. So with that, I want to highlight one other thing, and then I will turn it over to Eli, is that in no small part has this also needed, and you all have highlighted this for me over and over again, and I appreciate it, a different kind of working for EEC ourselves. And so one of the things that you have in the slide deck that is just an initial part of the conversation as well is the restructuring of our organizational chart, which helps us be able to focus on these types of strategies in collaboration with each other, and some intentional growth and capacity that both look at how do we develop and think and use data to help innovate and drive the iterations in the future, but also how do we build a subsidy system that isn't just about financial appeals if someone doesn't like it, but also helps drive and coordinate across resources. And then the addition of a division that will really be not exclusively, because as I said, collaborating with everyone, but that will have capacity dedicated to thinking about how that fits together at the community level. So really looking at the community infrastructure we're building with that. So I just want to highlight, we won't spend time on the organizational chart. This will be part of conversations we'll have ongoing as we grow and invest in this capacity. But I want to highlight that what you have here also lines up to the capacity we're building to do this work. And part of what we're looking to begin the dialogue now is how we set priorities, how we invest in, or how we set metrics of success for these priorities and these investments over the next couple of years as we make these changes, to be able to calibrate that capacity building to be able to do the right kind of work across all of these really interdependent components that we're building real time. And using real-time data to try to drive. So as I said, you have the data today, looking forward to conversations on that, and I'll hand it over to get a deeper analysis of that.
Thank you, Commissioner. So as the Commissioner shared, my job today is to help tease out what we're learning from all of this data. thinking about what families might be eligible for subsidy and pairing that with how families are currently relying on subsidies and thinking about what that means for the future for the system as a whole. And I think that what some of this new or more current data gives us is a sense of the degree to which the current system is meeting the needs of the working families from lower income households that it's really built to support, meant to support. And so I want to focus most of the conversation on the income eligibility pathway to subsidy. So that is for families whose household income and parental employment status suggests that they would be eligible for tuition subsidy. It is the largest share of subsidy utilization. So in January 2019, there were about 34,000 children who were relying on this type of tuition subsidy. That's down about 13% at this point to about 29,700. But it's also one of the reasons we want to focus on this is it's the subsidy pathway where EEC has the biggest kind of mechanisms for change. So through policies, through contracted supports, through a lot of the other factors that are within EEC's control, thinking about how those could be used to increase affordable access to care for working families. I do want to just quickly say there are two other pathways to subsidy. The first is for families who are connected to the Department of Transitional Assistance. That's the department that administers economic and food assistance like SNAP benefits, et cetera. And this group has gone down from around 11,000 children participating in January 2019 to about 7,400 now. So it's a steep decline. This may be tied to larger trends that we see at the national level around decreased participation in TANF and other entitlements, but that is a decline that we note. The other pathway to subsidy is through referral by the Department of Children and Families, often tied to cases of child abuse and neglect and other factors like that. There were a little over 10,000 children supported through this pathway, and it's the only one where we've seen any increase since January 2019. It's not an area you want to see increasing, but that is sort of one other pathway to note. So our first question, thinking about income eligibility for subsidy, is what is the total addressable market of children whose family income and family employment status suggests they might be eligible? So we know that there are 950,000 children in the Commonwealth who are between the ages of 0 and 12, and that over half live in households with income levels that are inside that subsidy threshold that might be eligible. Then we need to think about how many might have what we call a service need, where the parents or the guardians who are living in the home with the child are working or in school or in active job search, et cetera. And so in Massachusetts overall, that's about 3/4 of families, but that's a little bit lower as you think about lower income bands and increases as you go higher and higher in income. So when one adds all of this together, income level, employment status, et cetera, we believe or estimate there are about 500,000 families with children ages 0 to 12, or 500,000 children, living in families with the relevant income levels and employment status. So that's the context in which we're working. So then we want to look at who is actually using the subsidy system. And what we see overall is that there has been a decline of about 14%. We see about 47,000, a little over that, children whose tuition is subsidized. So we know that we're not meeting the current need, and further we see that those utilization patterns are going down. So they're going in the wrong direction for what we want to accomplish. I do want to put one caveat out. We don't necessarily have a way to account for variable family needs and choices when we look at population data. So many families may rely on other types of care, et cetera. That's just a caveat to put forward. So I think it's important, or one of the reasons that we wanted to share so much data in this meeting is that it's important to think about the nuance behind that overall decline to increase our understanding of how families have accessed subsidies over time and help inform what might be needed for the future. As one example, we know that across every age group, we've seen decreases. So about 500 fewer infants, 1,500 fewer toddlers, 3,600 fewer school-age children, 2,000 fewer preschoolers. So we know that there are declines across every age group. We also see geographic variation in the degree of decline in participation, but we also know that there is a downward trend in every single subsidy region. I want to just call out 2 specific regions to talk about how some of the data and some of the dynamics that might be in play could inform future thinking about subsidy participation. So looking first at the Northeast region, how are multiple factors sort of tying to this concept of subsidy access? We know that the region has over 150,000 children ages 0 to 12, and a little over half of those are likely eligible based on income. Before the pandemic, we know that in this subsidy region, there were almost 13,000 children who were participating in the system, and that's down by about 1,000. So it's a 9% decline. So what's going to be relevant for this region moving into the future? We know that when we look at jobs growth, between 70 and 90% of the occupations that are projected to grow through 2028 are tied to lower wages, lower educational levels, greater presence of the need for non-traditional schedules and care. And so there are flexibilities needed within subsidy access, as well as perhaps increased need for subsidy within this region. So as the work landscape shifts, we'll probably see a lot of variation across geographies in those types of ways. Looking at one other region, thinking about the metro area, relative geographic footprint around the Boston, so not the Metro Boston subsidy region, but the area around it. This is the region with nearly a third of children, 0 to 12 in the state. So it's a very large number of children. It's also the region with the lowest subsidy participation. Right now, around 5,800 children have a subsidized tuition from this region. But there are some mitigating factors. So it's the region with the higher income levels. The income analysis shows that a little over 30% of the families in that region are within that threshold for subsidy access. So it's one of the lowest sort of percentages of a potential access there. And when we look at future jobs growth, it's largely jobs requiring higher education levels, tied to higher median wages, often more traditional work schedules. So that's a very different sort of future-looking subsidy access equation. However, as a region with the highest volume of children, there's certainly still quite a distance to go to actually reach or support all of the families that might perhaps need that support. So these are the kinds of nuance that EEC will continue to try to understand in order to look at strategies for affordable access moving into the future. So in summary, I would say that pre-pandemic, we know the subsidy system was not reaching a threshold of families who might have been income eligible, and we have seen declines across almost every dimension. And when we think about that strategic plan goal that the commissioner referred to in terms of addressing affordable access, we know the subsidy system is one of the biggest levers within EEC's control. But given all the data we have before us, we know that it will need to undertake some serious strategies to reverse the trends that we've been seeing through the pandemic by leveraging things like subsidy policies, the structures for subsidy administration, waitlist management, all of the kind of mechanisms that impact family participation. So I will turn back to the commissioner to speak to some of those shifts that might be required in light of the data.
Yeah, and I will just highlight a couple of things, and I'd love to hear any questions around this for as we dig into this and before we go to the specific trajectory for the childcare system, the subsidy system specifically. One of the things is we won't spend a ton of time on the caseload data, but I know we do put this out to you every month and at the legislature as well. And just want to highlight, as Eli went through the trends we've seen over the year and where we are right now. there hasn't been a lot of shift in these trends in the last couple of months that we have been watching around some very key components. One, we have seen enrollments or stagnate at this level of across all of our grants. So as Eli said, when you look at the historical trends over the last year, they've certainly been declining. We were hopeful that where we were right now in the pandemic, knowing COVID, we have COVID numbers are starting to decrease, that we are seeing antigen tests out, that we would start to see some pickup at this point, and we aren't quite seeing that in some of our subsidy numbers across all entities. I think what we have been working to understand from our subsidized providers, where we can make immediate shifts or thoughts around, again, continuing some of the policies we've been putting in place. Paying by enrollment instead of attendance has been a big shift for programs, because it meant that families could access the slot even if they didn't need it every day without penalizing, without being penalized, or the program having to make the decision around the loss of revenue if a family can't come every day. And looking at the closure data, that's certainly something that was a protective factor in our subsidies, to be able to try to keep every lever open for programs as we move forward. But we have been working to understand with our providers why. I mean, we don't talk to, as you all know, we don't talk to every family. We have lots of contracts in place to help provide more one-on-one support for family, but that means we don't always get those anecdotal trends that people hear when you're actually sitting in front of family to understand that qualitative approach. So we are trying to understand more of that. But you do see, as you see in the caseload amounts that are income eligible, both across vouchers and contracts, continue to be pretty much on par. In general, what we end up seeing in our subsidies often is a dip in the fall, and then a climb back up, like from summer to fall, and then a climb back up over the fall as families settle into their new school year. Maybe adults or jobs shift or something, and they get into enrollment. That's what we haven't seen this year. We saw the dip, but we haven't seen it climb back up, and that's the most concerning part, I think, as we think about accessibility for families. As well as that, we don't, in terms of our wait list management, we've been working closely with the child care resource and referral agencies who do all of that management. So if you think about it, there are two ways for families to get into the child care subsidy. One, you can contact a program that has a grant, and if they have enough room in their contract, they can enroll you directly, or you go through a child care resource and referral agency and you get enrolled into a program. We are seeing from that way, we still see our wait lists are growing, but we aren't seeing our enrollment grow with that. And that's another concern. So more families are signing up for those wait lists, but they're not getting off of that. That is not because we don't have available funding for them. As you see, we have available funding, our enrollment's going down. We'd like to be able to give them funding. And this is where some of the qualitative data and research has to go in and couple with it to understand, is that the programs available to them don't meet their needs? Is it that their program for the age group they're looking for is full and there's not enough capacity in a specific age group? Is it that there's a number of different reasons, but I think that's some of the qualitative data, that it is so much more than just looking about the funding for subsidy. And it's a very nuanced to understand how an individual family makes an individual choice about their children, and how we make sure there is the infrastructure available for them. So our subsidies deal with the affordability, but can't deal with the infrastructure in totality, as getting back to the original point. So I just wanted to highlight that, because I think all of this data fits together, and those of you who don't live and breathe it with us every day might see different things in it. And I'll open it up, and then we can talk a little bit more about the subsidy program specifically after we understand this.
Thank you, Eli, Commissioner. Trying not to have heart palpitations about the idea that we got families on the wait list, we got a child care crisis, and we're not filling the slots, right? If you had to just tell us from your own perspective, not to be wildly defended with data, but Commissioner Eli, like what 1 to 2 factors pre-COVID would you point to as priority factors? Like if you were going to solve for just, we don't have, let's say we're, we'll get out the canvas at some point, et cetera. What are like the first 2 things that you would put in the hopper as needing to be tackled immediately that are serving as barriers and or factors that lead to this from the family perspective?
We are very lucky that Eli is the same person who helped be on the ground listening to all the strategic plan conversations through that, because she probably has a lot of nuance. But I would say that what we heard through that was the complicated nature of enrolling in subsidies. And those of you who know from different angles, it is particularly for income eligible, to the point the biggest bulk of inclusion in the subsidy system, as well as where we have the most control, because it's not an entitlement path. So you have to actually demonstrate your eligibility. It can be incredibly onerous. And things like the gig economy, which does not have a job that you go to and start to verify that you are working there, and then you get an hourly rate, and which is much more conducive to demonstrating an income that is eligible for a subsidy. Those kind of complications, I think, make it very difficult to access this, and I think need to be addressed if we're really going to address that. That is a regulatory change in many of that. So that is why that has been on our radar, to dig into the regulations that dictate the subsidy eligibility criteria and the process for that, try to simplify them and identify places we can streamline. The second thing I will say in there, and I think this is a part of the tension today, is understanding, allowing the subsidies to not serve all roles in the childcare sector. I think one of the things the country is grappling with right now is that in 1996, when the federal government shifted the subsidy system and put different regulations around it, there's a lot tied to that, in which program quality, program infrastructure, program sustainability is all expected to be done based on enrollment of low-income families. And that's a tension in our system. When we look at things, parent fees was an incredible tension over the last couple of years from us. As we make parent fees more flexible for families, so if you can't pay your fees for very legitimate reasons, low-income families, a car issue can really destroy your budget for a month. Right. It's very hard to absorb, $200-300 expense when you're grappling with that. But if we start to allow families not to pay that family fee, which is required by the Fed, so it then has an impact on program revenue and their ability to actually pay, or EEC has to make it up, which has an impact on our budget. And so really understanding this tension of how do you provide more flexibility for families while we don't expect that affordability strategy to solve every problem in the system, I think is part of what we have ahead of us. And I think, Eli, I'll let you if there's more nuances to what we heard in the strategic planning process, but I think that's what we started to try to uncouple as we developed the pillars of our strategic plan, is to understand how we needed various strategies to address various components.
I think also just building that data muscle to be able to predict and push towards better match between what is available in the subsidy system and what we know families need, region by region, and sort of pathway by pathway.
Mm-hmm. That goes to the programs that accept subsidy and the kind of classrooms that exist, or the kind of family childcare that exists to be able to use those tuition subsidies.
Yeah, and I sit here and listen, and I think a lot about this notion of the family trying to produce all the right information and evidence, and the administrative burden in terms of this verification. And you sort of, it gives you pause, right? That the whole system is trying to organize around sort of, you show us, and now you're a gig worker and we don't really know how to deal with that. And that's a lot of administrative time and effort. And here we are, right? Mm-hmm. Sheila, and then Nikki.
Yes, I certainly agree with everything that's been said, but I don't think we can forget that even back in 19, there were large centers in Boston closing in every region because there was a lack of staff. And I think it goes back to staff compensation and the fact that our people are underpaid. And I mean, that was a problem long before COVID. People were closing classrooms and there just wasn't the capacity to meet need.
Yeah, but yeah, I mean, we're
in certain places.
But we're zeroed in now on this other issue, which is we've got capacity and we're not fully enrolled. So we're going to have to wrestle with that. Nikki.
Yeah, I just wanted to, as somebody who sort of works for an agency that helps parents to navigate this system, I just wanted to echo, Commissioner, I appreciate your attention to the fact that this is a really complex system for families. And I just want to make a pitch for, if there's any way that we can reduce administrative burden on these families. These are the families that are least able to deal with this kind of administrative burden. This kind of administrative burden is difficult for me to deal with as somebody who, is college educated and has, lots of support and lots of, mental bandwidth as far as things are concerned. But for families who, have less education, it's very difficult to figure out the systems in the first place. Trying to get together all of the necessary documents and attend the necessary meetings and things like that is a burden that keeps them from being able to do other things. And sometimes it's just too much to juggle and people give it. And then the other thing that I want to say is that it is an impediment to families' economic mobility to have these kind of administrative burdens, because what ends up happening is if somebody gets a job, they're not always able to start that job right away if they don't have the child care in place. And if the wait list is taking all this time for them to work through and they getting themselves, verified and everything, it's just counterproductive for what we really want to be doing for families in the child care system. So yes, big proponent here of trying to reduce the administrative burden as much as humanly possible.
And I think, Nikki, at that point, I think as we think about that, one of, as EEC has started to organize ourselves to be able to understand and bring components of the conversation over the next year, these are some of the priorities we're going to have to grapple with, which is how do you ease a burden and still meet federal regulations? Where are we willing to set priorities in terms of easing access? And there are going to have to be choices made. And so I think these are some of the questions now of how do we start to prioritize where are those areas that we think are most onerous and most burdensome, and start to figure out what data we can use to and it may not all be data we have. Some of this is going to take different kinds of conversations with people at Empath and other type expert roles to be able to try to figure out where do we set some of these priorities, because unfortunately we are not going to move from where we are now to the universal system overnight. But if we want to be able to take the universal system everyone talks about, if we have a universal system, that's great. We have to start making incremental choices with the system we have if we're going to start to see improvements. And I think this is the conversation ahead.
Yeah. Maura, go ahead.
I'm just wondering as I'm listening to this conversation. So if Build Back Better had passed, or if/when it does in the future, and it includes greater dollars, changes in eligibility, are we essentially in trouble at this moment if we don't do some of this legwork to take full advantage of it?
Yes and no. I don't want to say we're in trouble at this moment. I would say that if Build Back Better had passed, these questions would have been on the table the way they are now, and there would have been urgency to solve them. I think that every state in the country is grappling with this very similar system. The federal government has designed their childcare system around this per child enrollment model, and set many system-wide expectations, things like a quality rating system on that. And I think Build Back Better continue to emphasize the interconnection of the two, but also from my colleagues across the country that we were advocating and engaging and trying to understand what components would mean for each state. That conversation with the feds was, we need time and the right kind of regulations from the federal government to be able to actually detangle the multiple components. And so would we have been in trouble? We would have been in more urgency with a tighter timeline to answer these questions, I think. But I think that they would have necessitated the time to figure them out at the federal level. And so at this point, should there be a Build Back Better resurgence, we still have to answer this either way.
Joni.
So I'm thinking of our meeting in Worcester in March, almost 2 years ago, when was the last time we went outside, right? And we kind of launched the strategic plan, which was really exciting to me because we were attempting to build that system and to engage families and communities in that system. You know, clearly we've had to fall back a little bit because we've had to deal with the realities of the day-to-day issues. But as we're talking about the questions and the challenges and why aren't families enrolling in programs? Why aren't they accessing subsidies? It does, I do feel a bit encouraged because of many of the systems that we do have in place to begin to answer some of those questions. We have this new, if people take the plastic off, the shrink wrap, as we used to say about the curricular frameworks, the family engagement frameworks that really allows communities to drill down and have conversations with families to engage families who might not be engaged. So it might be feasible that a community member might say to a group of families, what do you need? Right? Why aren't you using it? Rather than an agency that might be hard to access. And I know, Sam, we've talked about this back and forth. I think we have that. We also have, and I think it's really exciting, a number of programs at the local level. And I know hopefully we're going to get to this later on in the conversation, at the local level that addresses this. We really want to look at the CPPI program. What have we learned from that program that allows us to answer some of these questions? Speaking as a CFCE coordinator, I had to address these questions. We all had to address these questions in our RFR last year, in terms of how are we building community collaboration so that we can begin to address these questions. I think we have many opportunities to hear individual voices and to begin to answer some of these questions that you have, because while we want to, as Noni had said, build the system rather than look at individual pieces, we need to do both at the same time, right? We need to fill those. And I think that was the tension, Noni, that you're talking about.
Yeah, no question. But your comments also circle back to our first couple agenda items where, you know, we were all in agreement, like some of the information is not for EEC to collect, but rather to be collected on the ground in communities. The trick is, how do we do that with a feedback loop that's not so anecdotal that we start to really get? So we need to figure that out. I think we need to figure that piece out. And that seems to me a through line, Commissioner, in this meeting is how do we modeling from this set of data that we looked at for today's meeting, which is so systematic and really well displayed and really well done, how do we now dig in and do something qualitative and more on the ground, but that is robust enough to surface patterns and trends? That's the challenge, right? And so we need to think about that collectively. But it's clear, Joni, no question, that this is a moment to sort of get underneath some of these patterns and trends that are surfacing through the only way, which is the quantitative data, and to think about who are the partners on the ground, who are the people on the ground that can inform some of the really community specific. Eli had some great data on the ways in which we're serving very different populations in very different communities with very different work profiles, et cetera. So we need to think hard about that strategy so that it's robust and also somewhat systematic.
Yeah, and I think, Charlie, so I think that one of the things I would highlight, the feedback loops are so vital. And I think one of the things we hope that EEC is building through this kind of data release is the initial part of that loop, the initial part, that by giving this data where we're showing by region, by demographic, by trend, where is enrollment, that our CFCE providers, our CPPI providers can start to disaggregate some of that and help understand what questions would be most relevant in their communities based on this, and then bring that back in some anecdotal with trends that aren't just an anecdotal family, but understanding community-wide what is happening, because I think this is the big challenge we have, and we do need our partners to, as you said, and this is the through line, and hopeful that we're prompting that with some of the data we're putting out. I will say on that we, as you all know, we have built incredible amounts of data analytics capacity over the last year through our work with 3SI, through our investment in staff that can do some of this, through our ability to start to put out data trends. And we're really open in the conversation I hope that we're having with the board, and very happy to have more conversations for those listening, to try to disaggregate this in ways that would be more meaningful to specific entities. This is obviously a very broad brush for the fact that the board takes a very broad view of the Commonwealth. But knowing that those specific entities, this allows us to dig deeper and to have people to come to us, and not to call Paul out again, but that was some of the conversation that he had after the last meeting, of being able to come back and say, you know, what would be helpful for philanthropy is to have some of this information disaggregated in this way. And those are the conversations we're super eager to dig into, to create some of that feedback process.
Yeah. And some of this is just, you know, because we are only a year in to sort of this approach to, it's really about a data use culture. So Maura, I'm looking at you like thinking, you know, part of this is we do statewide work, you put out, you know, statewide data, which is excellent. That doesn't mean that there's a direct line to policymaking, right? It's that it motivates the macro, but now this next kind of layer is really about digging in and really capitalizing on the data use idea. So, yeah.
And I think I always think about the policy triangle of policy, research, and practice informing each other. And so I think that's what we're trying to get at here, is where can our policy lens and us contribute to the research, data analysis, that the practice can both be informed by and be used to feedback
completely
the state level.
Yeah. And no richer of a focus group than one that starts with some data, if only to find out, actually, this didn't really actually make sense to me on the ground. And so it doesn't really apply. Like, those are great, those are really rich moments. What else, folks? Anything else for Eli and the commissioner? This is random and maybe a little too weedsy, but I keep thinking about, if you look at Pew these days, right? Almost everybody has a smartphone in their hand. And I just keep thinking about, maybe I'm fixated on this, but I keep thinking about like, this is like the pen and paper, and I'm verifying and I'm filling out forms. I'm going to a physical location, and really in the rest of our lives, like, we've all gotten across the income spectrum and across the education spectrum, we are using this for most of what we're doing. And I I just don't want to lose that in all of this, even potentially in the short run, as we try to make the system more accessible. Like, I'm thinking, like, how can we fill some of those spots in the next like 3 months, right? And where does the technology piece come in? Is there a QR code I could be scanning with my phone? Is there a way that the gig economy, I could show them my receipts? I don't know, but I'm just, at the brass tacks level, I'm feeling like I'm gravitating towards the smartphone that's in everybody's hand. 94%, I think, is the Pew data.
Yeah. So that is maybe a transition, perfect into some of what we're doing right now and some of what we need to actually keep iterating on and who we're working through. So obviously we rolled out our parent fees, which has been a huge asset for us to be able to make it more affordable for families who are on our subsidy system. And quite frankly, to Nikki's point, make it desirable for families who may have thought it's not worth the benefit in the end, if to go through all of the paperwork, if the fee is going to be expensive. And I think to our earlier point of programs closing who are serving socially vulnerable communities, but not accepting subsidies, that there's a trade-off there that we hope this allows them to feel like it is more beneficial to families to accept subsidies when their co-pays are so much lower than they could offer for the cost benefit of engaging in a subsidy system. So that's a huge thing we've done, obviously, and given the fact that family fees just started being paid, paying their fees February 1st, and that programs are in the process of working with families to make sure that this rollout is effective, that's just very much in process. But I do want to focus, I think, as you were talking about mobile phones and technology resources, our eligibility for families is done through childcare resource and referral agencies. So EEC doesn't talk to those families unless they have an issue. And so that's actually something we've started to do with them and started to engage on with them, is using electronic signatures, using virtual meetings, using those kind of strategies that we know were required during COVID, and we needed some infrastructure to build and sustain. And so that's been something, I will say, we've focused a lot on the lowest hanging fruit and maybe not the kind of innovation like QR codes and things like that would eventually be built in, but trying to understand our current infrastructure's capacity to make these pivots has been incredibly valuable in this time. And we have started, there is an additional appropriation that was given to CCR and ours this year. It's not a major one, but it's an incremental one, and really understanding those costs that they might incur to be able to do this exact kind of responsiveness, particularly as you look at getting families back to work, needing many of our childcare resource and referral agencies are co-housed with employment resources. So how do they build capacity? They might intentionally learn from each other about where those kind of questions, with the idea that this is one of the contracts that will need to be bid over the next year, and understanding that these kind of innovation should be part of that bid, and that we need to learn from what we have now in order to best inform where should we prioritize those, right? And would people be more receptive if they were getting childcare services while they were going to their employment services? Or is it about more electronic resources so they can do it from home? Or myriad of different options here to that point. That said, I think that the other thing that we have been able to do, which I will highlight just in terms of EEC, I've mentioned before, but we've put some of our regulations in place. In previous board meetings, we've listed out those ones we've kept, so we didn't include that here now, but certainly paying by enrollment instead of attendance. Certainly allowing emergency closures to happen without penalizing families, changing our co-pays, and we are paying co-pays when there is a closure. So traditionally, if there was a snow day or something along those lines, families would be expected to pay the co-pay, which was real tension for programs and for families to say, how do I keep myself safe and there's an emergency if it's going to cost me money? So starting to do some of those things that we are allowed to under our current regulations. regulations to be able to make those modifications, because the next step will have to be really redesigning our regulations and trying to understand the most impactful components. So that's something we're really thoughtful about as well. So you do have a timeline in here of where some of these questions are coming about. But I want to highlight one other thing on here is around what Eli focused on in terms of our income eligible and our other entitlement pathways into the subsidy system. There is a question also of how can we best structure ourselves where if it is an entitlement system, we can minimize the number of steps for a DCF involved family to access childcare that might help them avoid more involvement with DCF over time. How do we minimize those steps? And the same thing on some of the DTA entitlement. Are there ways that we should be thinking about streamlining this? There are a lot of federal regulations or expanding based on what we're seeing around DTA enrollment and family needs and getting back to work and those kind of things over the specific populations. And so we are also asking that question around, are there ways to more efficiently and effectively run the specific entitlement programs while we really try to disentangle and streamline what EEC has the most direct control over, which is the income eligible process.
Right.
So you have a timeline, and that is mostly to indicate, and I want to highlight that for all of you, that there are so much of EEC's investment in the field is tied up into components of the subsidy system, that this is a multi-year, pronged strategy that will have to be very informed and very robust. We are at the beginning of it. Given the fact that we bought ourselves in the last 2 years, a lot of incremental innovation that will set us up to teach us a lot for over the next couple of years.
Yeah, I appreciated the timeline. I also think we've learned a lot from some of the behavioral science work and some of the social, in some of the social services too. And I think there's reason to look at some of those key learnings as we think about, some of what we're really talking about are behaviors and trying to support and reinforce certain ways of doing and on both sides, right? Parent and agencies, CCR and ours, et cetera. So I think it'll be interesting to look there too. But I appreciated the timeline. I also appreciate how much data we'll have to look at, which is critical, because a few years ago, it was sort of like where to even begin, right? So we wouldn't wish COVID upon us, but some of what we've learned is going to be super, super helpful.
And to that note, I just want to highlight, because I don't want to spend a ton of time on disaggregating the caseload data. We spent that on here, so we won't spend too much time in that agenda item. But I do want to highlight that when we, to that point of what data we'll need to look at, it will force us to have a conversation about how and where we report on monthly caseload data and subsidy enrollment data to help inform this. And we really look forward, now that we do have the data analytics capacity starting to be built. It has been one woman sitting there with an Excel sheet getting you these data for the last many years.
I know.
We now have a cloud-based analytics system that can look at things like trends in enrollment, can look over time. And we just in the last month started to get that operationalized. So really look forward to these conversations with you all, with stakeholders you represent or suggest to talk through, to really disaggregate that and get the right kind of trends to help inform this over time, so that we are looking, to Moria's earlier point on the program level data, I think on this data too, that we are looking at the right kind of targets and understanding and asking and informing, to Joni's point, and asking the right questions going forward.
Yeah, I was just about to say that, which is, I do think the next step is this notion of targets. And to Maura's point, so we don't hit them, but what if we don't hit them? What did we learn, right? And if you don't have a target, you don't have that conversation. So that's great. I really appreciated that point. But it also demands the kind of data infrastructure that you're talking about, where we can see the dips and the line over time, right? Mm-hmm.
Yeah.
Anything else for the commissioner on the kickoff? I think of this sort of as a kickoff conversation to some of this work that's laid out in this slide with a timeline that's really important. And I think can't be too aggressive in some ways if we're going to take what is currently a system where the key stakeholder is telling us this doesn't really fit for me. It's not that accessible, even though I know it holds great potential for my lifestyle. So I think, it can't be too aggressive a timeline in some ways. And I think in the intervening months, I think we continue to innovate as much as we can with the macro big picture in mind so that we can learn as much as we can. Other last questions, comments for the commissioner? All right. Well, with that,
we have one more agenda item.
Oh, right. You're right. We do. I'm sorry. The actual caseload update.
Well,
right?
no. So I wanted to talk a little bit about the CPPI and the CFCE.
Oh, right. Okay. Sorry. I thought I'm sorry. I missed that.
No. I wanted to go in deeper to Joni's point of being able to talk about what we're learning from there, which I think complements the conversation we had.
Yeah.
Well. So of course, and I think Joni teed us up for it well, of understanding that there are a number of players on the ground looking to support families, both in getting and accessing childcare, but also, all of the other resources they need to support their families. And so there are many investments we have, and to Joni's points, the coordinated family and community engagement grants, there's been a lot of work with them over the last year and continuing to think about the year going forward that we hit on I think 2 meetings ago, last meeting, of really starting to understand what we can do to enhance and think about integrating them more into the overall system that we envision through the strategic plan. But I think there are 2 components of the CPPI work, of the community investments. The 2 components we wanted to highlight was the Commonwealth Preschool Partnership Initiative, and I'll describe what that is and what we're learning from it, as well as the Family Ambassador Program that we started to invest in. So as we talked about, childcare, and I just want to reiterate something I said at the beginning of the last meeting, the childcare infrastructure is vital, and affordable access to that is absolutely essential role that EEC plays. However, there are community level infrastructure and enhancements and investments that we also play a critical role in, and this is where I wanted to dig in. So the Commonwealth Preschool Partnership grew from the Preschool Expansion Grant, which is a federal grant. The objective of the federal grant was to increase access to full-day preschool for 4-year-olds in mixed delivery settings, which in this context really means school-based settings and childcare settings, whether that be center-based or family childcare. But that's actually where the Preschool Expansion Grant was pretty explicit on those strategies being the strategy to 4-year-old full-day expansion in those 2 settings. As CPPI emerged and took that infrastructure on and continued to invest, the way Massachusetts designed that investment was an investment through school districts that required them to partner with childcare settings to be able to address 4-year-old enrollment in full-day preschool settings. That included, for what the initial work on CPPI a few years ago and Preschool Expansion Grant, what that included was enhancing services, aligning the quality of the services, the curriculum provided, the professional development, as well as net new or expanded capacity. Through COVID, we had a myriad of different learnings across the communities that we've invested in. There are 9 communities that we've invested in and continue to invest in. But this year, as you remember, over the last couple of meetings when we talked about the budget, there was an increase in funding for the CPPI program that offered us the first opportunity to start to implement some strategies around that learning. The learning from the Commonwealth Preschool Partnership, I would say one of the number 1 things we learned is that in many cases, communities didn't have the local level planning infrastructure and capacity to be able to make sure that they were maximizing that investment across settings, and really doing that conversation around, what children were best served in what kind of setting, and how did the school district and the childcare come together to talk about why a family might choose a childcare program that had extended hours, extended day, versus a school-based program that might have school-based hours. In many cases, we heard that the investment in childcare was limited by the fact that a family enrolling in childcare, in the childcare CPPI program, had to also qualify for the childcare subsidy program in order to be admitted into that program. Obviously, we just talked about all the complications that can incur, and we saw many communities that were really grappling with trying to put two very different systems together without the intentional planning capacity and support to be able to do some of that. Through Summer Step Up last year, we were able to invest in some of the capacity that both national and local supports for communities to do some of that technical assistance to understand how and where do you start to look at data and understand how it's talking about the same families. We also found that our childcare programs often didn't necessarily know what questions to ask at the table from a school district. And so really trying to figure out how do we start to provide the supports, what I sort of call the translation supports across two very different systems that have two very different accountability and two very different structures for accessibility. How do you start to have some of that? Some of our communities were better poised for that than others, and some of them we saw, for example, our CPPI communities actually expand preschool in school-based programs to the detriment of our childcare, even though we had been investing in a preschool expansion and CPPI over many years in those communities. It still didn't set them up for the kind of conversations they needed to have when there was a significant school district level investment outside of the CPPI grant. So one of the things we really intentionally thought about in this expansion dollars is what kind of capacity we could build over the next 6 months at the community level that would best prepare people for implementation of expansion. This is something, I mean, in full disclosure, if you look at any community around the country that has expanded preschool, one of the biggest challenges they've had is exactly what I just described. Understanding the investment in preschool as the impact on the overall system. New York is the prime example of this, that you can see that as they expanded a commitment to universal full day for 4-year-olds, they then found when they turned to 3-year-olds and infant and toddler, there was no capacity left to build on, or very little capacity left to build on, because that kind of intentional conversation hadn't been had across the entire system at the starting point. So our efforts this year have been focused on building planning grants for communities at this point to start to think about planning for expansion of preschool specifically. I want to be clear, like, this is one component of an expanded system. We know we need more infant toddler services capacity. We know we've seen dips in early intervention uptake. But we also see that school districts right now are starting to think aggressively about expanding preschool and want to be able to start to influence how we bring the right players to the table up front so that we understand and can inform the overall impact that might have. So the planning grants are in two forms. One is certainly those that are just starting to plan and really bringing the technical assistance to think about how do you get data from multiple players, bring that together. That is a person's job. That's not just an add-on as an hour on the side you can do. That's actually a job that we know someone needs to invest in. But we also have many communities that have already started to expand this year, given the ESRA dollars that school districts have, and they had been in conversations before we could get the statewide implementation and support out there. And so we've also built a grant around implementation that would help build some of that planning as they are implementing and as they are expanding, so not to slow programs down or not to or not to slow communities down, and not to have communities that have gone on their own then feel like they don't have access to any of this planning. We've designed it in a way that can meet many communities at different phases of their thinking. That I think is something to Maura's earlier point, that is something that I think we will need to continue to think about, because should Build Back Better or any other federal prompt towards expanded preschool come, this is the asset I think Massachusetts has to make sure we are best prepared, we're asking the right questions, and most importantly, we are not leaving every community on their own to try to figure out how to negotiate across very disparate systems, but are really building that intentionality, can build strong metrics, strong accountability, and supports to meet that, but not in a punitive way, in a constructive way. So we're pivoting if we find that didn't work. What do we do to make sure children continue to have expanded services? The other thing I just want to highlight, and then I will stop talking, is the CFC Family Ambassador Program, which is also an element of this. I think to the components of what we were all talking about before is that EEC is not the strongest messenger. In many, many cases, and I think, again, if you look at national data, if you look at national community level data, parent-to-parent messaging is the most effective way to try to talk to parents about resources. And so one of the things that we see all over the country is different strategies to try to inform and empower and invest in the type of parent leadership that will help them be those ambassadors around, informed ambassadors around what kind of supports. And certainly we have so many assets in Massachusetts to help build that parent leadership, given the CFCE, the historical investment we've had in CFCEs, given the Head Start investment that we've had from the state level as well. And so what we did, the prompt of building an initial family ambassador model was that we had a small amount of Head Start funding that was increased and was underspent. And we did have an ability to match that with other state funding and think about this parent leadership model that would be able to start to understand. We did an RFP and work with Families First, which is an evidence-based family ambassador program that could help understand how we could fit that in as an evidence-based implementation across a variety of different, very specific Massachusetts resources, and start to think about different kinds of train the trainer models and things like that that we could build that would increase our investments, the grantees' capacity to implement some of the family leadership strategies that we know that communities that will be the most effective way to support parents at the community level.
Maura, go ahead.
Thanks. Boy, lots of great learnings on all of these projects. No, it's awesome. And so I have a few questions on the CPPI, driven by my K-12 lens and knowing that superintendents deeply want to make something work, and so I'm so thrilled to hear about all the learnings. One is, okay, it's three. I think two are facts. One question is, what are we trying to accomplish in terms of going from 9 communities to more of a scale in the planning? Two is, what have you learned about like the local point people representing the mixed delivery system, knowing you've got like the singular school district, and then, you've got like you could have 1 million players, but that's complicated. So we learned any patterns or something there. And then the third is, what have you learned about what's going well and what's hard in terms of the coordination at the state level between EEC and DESE related to this? That's a lot.
Those are really good questions. I asked Jocelyn to come back on because she's actually manages the grant itself. I will talk a little bit about the systems level and then hand to Jocelyn talk about the learnings from the grantees we've been investing in. From the systems level, let me say that the expansion part is partially responsive to the number of superintendents who reached out to us. asking for help supporting planning their preschool expansion and looking at examples of models that we had a lens of where some of the gaps were, and wanted to help them avoid, learn the lessons we learned and avoid some of those pitfalls. And so that was where we knew some superintendents were like, listen, I got to do something this year. And some superintendents like, we want more planning and help before we do something, and designing the grant in a way that could help meet everyone where they were at and provide a plan for us that told us where you were at, and then really investing in the TA resources that would allow some of that capacity to flourish and help them do that. So the expansion is really point blank of the more communities. I will say the 9 communities that we had been investing were really focused on services at the ground level. These new grants are about people who really wanted to do the services, but we wanted to help them prepare as much as possible to do that, given our lessons learned. So that's some of the expansion intentionality there. And then the second thing I will say to answer your second question, then Jocelyn can talk a little bit more, and this connects to where Joni was saying around our CFCE investment as well. One of the biggest gaps that we saw at the local level was just the capacity dedicated to the coordination that we saw people wanting to go and do, and that they're actually, we were talking about oftentimes superintendents wanting to do what's right for children, wanting to do what's right for families, and having very little understanding of how this very different system worked to be able to bring them into the fold and think constructively. And that is, to me, it's like, if you ask me how the RMV worked, I wouldn't know either. It's a very different kind of system, right? Even though we have bus drivers, right? So I think just being able to kind of help understand a little bit better, that was a gap we were seeing that we really wanted to build from. We have not only looked at CPPI in a silo to do that. This is where our work with CFCEs, we have 88 grantees across the state, and many of them are embedded in school districts. And in doing that, we've also worked with them to say, as you implement your local councils, how are there ways to strengthen this coordination component of your work that hasn't traditionally been the accountability for the CFCEs. They've been really focused on services from that EEC lens. And as Joni said, over the last year, we recognized this gap. We started to see them as a huge resource to help fill it, and are strategizing with them to say, what would you need? How do we think about this, while we also implement the CPPI dollars, which came to us through the legislature this year and allowed us a chance to kind of learn 2 things simultaneously. So Jocelyn, you want to talk a little bit about the individual grantees and what you've learned, but just from the system-wide perspective, that's my response.
Yeah, no, and I wanted to dig into the question you asked about, sort of representative staffing of the planning process, which has really been, I think, one of the ongoing learnings is, sort of who has to be involved and when in this type of work, because it is not one person. You need, to the commissioner's point, you definitely need one person whose role is the coordination, because that is a lot of work, but it also involves a lot of different people at different points in time. There are the people that are really digging into planning the services. And that's a very different group of people in many cases than the people who also need to be on board and aware of what's happening and part of some of the conversations when there being decisions being made at a leadership level about how do each of these agencies that are involved, including the school district, allocate resources to support this type of effort and prioritize some of the goals that are being fostered through these coordinations. So and I wouldn't say we found the right model, and I suspect that the details actually differ from district to district, depending on the size, depending on who's at the table, and the nature of the private market in the district as well. But it's definitely important to have multiple local EEC entities as part of the conversation with the district. And it's important to think very, very carefully about, who's coming to the table and how are you structuring those conversations. And
I mean, again, like talk about the national issue. I can't tell you how many, I've worked with superintendents nationally in communities, tiny communities outside of Chicago to, Dallas, and very large communities and large school districts. Every single one of them said to me, can I just go to one person? And the answer right now is no. And that, I think, is a challenge when you're trying to think about that, to your point. And I think we don't have the solution, but trying to build some strategies that will teach us how we can compensate for some of that, because, you know, again, everyone's well-intentioned, but also speaks different languages coming to the table.
Joni.
I wish we did have that one person in every community. Wouldn't that be easy? I'm glad you mentioned the councils, because they're in existence, and actually, even though there's been some major reform to them 10 or 12 years ago, they've been in existence for about 20 years. The early childhood councils within communities. And I think it is a wonderful resource to build upon. And the councils are comprised of that mixed delivery system, which I think is really, really helpful. I think one of the things we need to look at or think about when we talk about expanded services and or increased services is finding out what the families want and why do they want it. Clearly, we know that families need it for care, shall I say. I think we've all been involved in needs assessments and focus groups where families say, I want my kids in an opportunity to socialize or to get ready to enter a more formal setting. And I think what CPPI has enabled us to think about is the different opportunities for preschool expansion, that whatever the setting is, you know, if it's a center-based program, if it's a public school, maybe it's a family childcare, and we have those comprehensive wraparound services available to support before and after, to support mental health, to support a whole lot of things. Then we're really addressing what it is that the community needs. The public schools are interested. They want to expand their services and provide quality education. The community programs want it. And here we have a wonderful opportunity to really take what we have had in the past and start to build that system and learn something that we can expand across the state. So I think we're in a really, really good place. If I can just say one more thing about pet project of mine, the family ambassadors, is I think this was a wonderful example to take out of some of our learnings, because family ambassadors were happening, or family leaders, or parent advocates, or whatever we wanted to call them, in a number of communities. And with EEC and Families First, this was an opportunity to, again, build a system, build a structure so that it can be replicated and give back to the families. So I think that particular initiative that you called out of CFCE is a really good one, and builds on, as you said, the Head Start piece of it too. It's my piece.
Thank you. Thank you. And I think this is where we really hope to continue to understand what kinds of evidence-based models might enhance the work that's done, that we can think about our investments strategically, Johnny, to your point, and bring in resources that will be, you know, most advantageous for those that are doing the work and have been in terms of our future investments.
Sheila, go ahead.
Just a really quick comment about the CPPI too. I think one of the interesting features of it in its early stages anyway is that it looked at learning outcomes for children.
Yeah, no question.
Absolutely.
All right, great. Well, our last agenda item we have largely covered. It's on the caseload update. You've got a number of slides. Commissioner, do you just want to say anything in summary of what we have?
Yes, absolutely. And so I just want to highlight on page 25, we did try to pull out some of the month over month data. We'll continue to refine this, but again, I think this is an area where, just two main points to pull out. One, we aren't seeing dramatic changes month over month. And so this is something that is of concern. We talked about the reasons and the thinking and what we need to do about that. But the second question is, as you all look at this and think about the data that we're seeing, what would be really interested for anyone interested in thinking about how we could better display some of the trends. Very interested in having some of those conversations. And we also do have for those of you less familiar with the nuances of our subsidy system, we also do have a subsidy 101 slide deck that we had done a couple of times for various councils that we can share with people if you're interested, and to help inform the conversation around these trends are ones we've highlighted, but if you know or see or are thoughtful about a different lens that we should be using, this is exactly the moment in time we are.
Great. We might even decide that that's a one-off meeting where we might dig into some of those questions at a time that's helpful to you and your team, Commissioner. We could have a sort of special session, if you will, public, of course, but to sort of dig into the data side of this. Really appreciate all the effort to get to real infrastructure on this one. Okay, well, again, want to thank you all. I especially want to thank the Commissioner, Jocelyn, Eli, Caitlin, for all the work that is reflected in today's agenda, and reiterate that, we are at a critical juncture. I think this was a great kickoff conversation to the kind of really constructive but also innovative reform that is going to be crucial going forward to sort of reverse some of these trends and really get to the systems level work that we have circled around for a long time. So thank you to everybody, and wonderful to see you. I guess we will see you next in March. Thank you. Meeting adjourned. Bye-bye.